Hi, my name is Saif I, and because it's summer, I'm still technically a first year medical student. In this video, I'm going to talk about the OSCEs, which are Objective Structured Clinical Examinations, and I'll also talk through the sessions that we have to prepare for these, because the OSCEs are where these skills are assessed. We get assessed on our communication skills, our clinical skills, things that we might learn on placement, and we can better prepare for our OSCEs by reflecting on our patient journey. In addition to this, we also have lifestyle sessions, which are basically like communication skills sort of workshops, and these again help us prepare for the OSCEs. So starting with our communication skills sessions, we learn things such as just asking open-ended questions rather than closed-ended questions, and also being introduced to acronyms such as Socrates, ICE and Plateau. So in terms of Socrates, we're thinking about the site, the onset, the character, the radiation, associated symptoms, timing, exacerbating factors and the severity. So when asking for the site, you just basically can ask, where's the pain? And with the onset, you can just sort of ask them when they first noticed that and what they were doing when that happened. When it comes to the character, you can just ask the patient to describe the pain or the symptom to you. And for radiation, it's just asking them if the pain spreads. With associated symptoms, again, it's just asking if they've got anything else. And with timing, you can just ask if it's something that sort of occurs at intervals or something that's kind of just going on all the time. And with the exacerbating or alleviating factors, you can ask about sort of medication that they might take or things that they do when they're sort of feeling the pain, like lying down or going on a walk. And finally, you can ask about the severity using a scale from 0 to 10, with, for example, 10 being the worst and 0 being completely fine. The ICE mnemonic stands for Ideas, Concerns and Expectation. And this sort of just allows the patient to sort of give their input on the consultation as well. So asking what their ideas are, what their concerns are and what they'd like out of the consultation. And of course, during the consultation, we consider several other things like past medical history, medications, allergies, family history and social history. Plateau was also another interesting mnemonic that we were taught because it considers the impact of the illness on the patient or like on their sort of loved ones as well. And this stands for profession, locomotion, activities of daily living, sort of like tiredness, their own time. We also had a session on empathy, sort of knowing how to demonstrate empathy and look like you are as well. We were also taught motivational interviewing, so look at the mnemonics such as OSCEs and Aristotle. With OSCEs, it was open-ended questions, affirmations, reflections and summarising. With Aristotle, we think, is it achievable? What will be their rewards along the way? How they can make the journey interesting, so allow them to be specific about what they're going to do, setting times around their goals, seeing how important these goals are for them as well, how it might have a lasting benefit and evaluating at the end. And with this, of course, we want the change to come from the patient, not the practitioner. Another thing we were taught, which is basically another component of the OSCEs, is clinical skills. This included sort of manual and automatic blood pressures, doing a news chart, using a pulse oximeter, temperature probe, checking respiratory rate, and so on. And with these, we had to update these into a news chart, all of which I've got videos uploaded as well. We also looked at myotomes, dermatomes, and somatic reflexes, where dermatomes are sort of an area of skin supplied by a single nerve. Myotomes are basically the same, but a group of muscles, and reflexes, again, are basically what it says in the tin. And the final set of clinical skills we learned in our first year was cranial nerves. And when it came to sort of assessing these, they were normally kind of split into 3, but it does make sense because the first set kind of more looks at the eyes, second one looks more like at the face, and the third set assesses your like hearing, your mouth and your tongue. And again, these are videos that I've got. So in terms of the OSCE itself, we have it split between clinical skills and communication skills. We had 8 stations in total, 4 were clinical skills, 4 were communication skills. In ours, we had about 7.5 minutes for each clinical skill, and then we had about 12 minutes for each communication skill, and altogether these made up our OSCEs. In terms of the sort of marking of the OSCEs, we had to reach an overall cut score and still pass a certain amount of stations, and in our year it's 5 out of 8 stations. Obviously the OSCEs aren't the only sort of assessment that we have in medicine. We also have the knowledge-based assessments, the professionalism domain, and we also have things such as our e-portfolio and CI points, which make up those domains. Another part of the skills domain, SSC, which is something that we did earlier on in the year, and this was a literature review and a presentation. I hope this video has been insightful and hope it's helped. Hope it's helped you understand what you're probably going to be getting yourself into if you want to do medicine, and see you in the next video.